pain a little bit. Pain seems to be an incredibly significant aspect of people's lives in different ways here.
Yes, very much in different ways, because some of them talk about it as agony, and some of them can be in agony and not recognise it as pain.
So very different thresholds going on here.
Yes, and one of the interesting things is that people can have a feeling without knowing what it's meaning. In the book Iris Johansson, she says, I had the pee feeling, but I didn't know that meant I had to go to the toilet.
Right.
And I had the hunger feeling, but that didn't mean I couldn't connect that with needing to eat.
Yes.
So you can have a feeling without connecting with the consequence, so to speak.
Yes. So is this that thing about the one side of the brain recognising the emotion of that feeling and the other side the function?
Well, it may be. I think we can't be categorical about that, but it is a possible explanation, isn't it? There's just a disconnect, and she talks about the disconnect between her feeling and her knowing what it means.
Understanding.
Yes, actually, I came to the conclusion after reading that book that she almost certainly had a problem with the corpus callosum, which is the band of fibres which connect the left and the right brain. Pain is a great problem for some people, and there's a particular form which it's taking with some people with autism, and also some people who don't have autism. And this is where somebody is beating their head, or they're beating their jaws. They're putting their fingers here, not behind, not in the ears so much as behind the ears, and pressing hard.
Almost at the back of their jaw.
Yes, that's right.
Yes.
Well, actually, just behind the earlobes.
Yeah.
Or they're grinding their teeth, or they're chewing things. They may rub their nose. They may pull out their hair here. They may bang their heads against the wall, and it appears that these people have, when it's been diagnosed, and I've met 5 people who've been diagnosed in the last 2 or 3 years, it appears that this is in fact not to do with autism. It's a question of sort of diagnostic overshadowing. They do all these things because they have autism. But this is not so. What they've got is trigeminal neuralgia.
Yes, and it's not saying that everybody who hits their head
No.
has got that, but it would be absolutely true for some people.
This is a particular giveaway, actually.
Yeah.
And the first thing you have to do is ask if the parents have had terrible headaches, or grandparents, because it's very often, not always, inherited. This is a very, very agonising pain. It comes on in surges, and the trouble is that all the work which has been done on it comes from dental journals, because what happens is that people are sent to dentists because they think it's a problem with the jaw.
Right.
And it's not a problem with the jaw. They think it's a problem with the teeth.
Yes.
It's a problem with the trigeminal nerve, which runs down behind the teeth. And what happens is, in people with this condition, is that you've got a vein and a nerve running parallel, and in the undamaged situation, there's a pad of tissue in between. If you've got trigeminal neuralgia, you've got no pad of tissue in between, it's worn away. So what happens is that when they get stressed, and this is where it connects with stress, the vein starts banging on the nerve.
Because the blood flow is different when there's stress,
right.
and that impacts the nerve.
Yes, and it's absolute. It's supposed to be one of the most painful chronic conditions there are. The parents or grandparents may have had these frightful headaches, but they may have been diagnosed as migraine, epilepsy, or cluster headaches, or there's something called thunderclap headaches, I presume is the same as the cluster headaches. They've been misdiagnosed because it's been missed out. One of the problems is that this is not supposed to happen in people under 50, but the Americans have found out they've been diagnosing it in 2-year-olds. There are things that can be done for people. they do need things done for them because this is agonising.
Mm-hmm.
A friend of mine has it, and she has autism, but she has this. Now, the interesting thing for her, coming back to pain, is that she didn't talk to me about the pain for about a year after until about a year after we've been talking about this. And I said, "Why didn't you tell me about the pain?" And she said, "Well, I don't know, I didn't. I thought it was, I didn't." And she couldn't explain. But actually what it turned out was that she didn't realise that this wasn't normal.
Yes.
How
does she know that other people don't have that?
Exactly.
Yes.
And when she wanted to go to sleep, instead of just going to sleep, she had to do this and press her head against the headboard.
Yes.
This is where the nerve comes out of. It comes out of the skull here, and it sends a branch up. Branch 1 goes to the trigeminal nerve, branch 1 up here. 2 is there, and 3 is down here.
Mm-hmm.
And if you put pressure on there,
yes,
it does actually marginally relieve it. If you've got this combination, and in one case I had a woman who was pulling out a square of hair just exactly on that where that nerve innervates. You really do need to look at this. Now, it's difficult to get GPs to even think about it because they say it doesn't happen under 50. And all the information is in the dental journals, except it's also in here now. Chapter 2 of the anger box, because I had in conjunction with a Canadian colleague, we had a very good look at this. And we suspect that it's more widespread in autism than people think.